Do I need to introduce like the COVID-19 pandemic? Do you think?
No, I've heard of it.
Okay. Here are 5 facts about coronavirus and the COVID-19 pandemic. Before I begin, I'd quickly like to go over some nomenclature. COVID-19, or coronavirus disease 2019, is the disease caused by the coronavirus SARS-CoV-2. It's kind of like how HIV is the virus that causes the disease AIDS. Now that we've cleared that up, let's get into it. Fact number 1. This is actually the 3rd coronavirus pandemic in the 21st century. Coronaviruses are viruses that affect mammals and birds, and up to 7 have been identified to affect humans. The first 4 types are relatively harmless and have been shown to cause things like the common cold, but 3 have caused mayhem in various parts of the world over the past 20 years. First, in 2003, there was SARS-CoV-1, or SARS-1, which is a coronavirus that emerged in southern China and made its way to North America, especially in Toronto, Canada. Then, in 2012, there was MERS-CoV, which emerged in the Arabian Peninsula in areas like Jordan and Saudi Arabia and made its way all the way to South Korea. And finally, starting in November of 2019 and extending all the way till now, in the end of March of 2020, we have COVID-19 coming from SARS-CoV-2, the novel coronavirus. Fact number 2. Based on fact 1, you might not be surprised, but coronaviruses do not come from drinking Corona beer. In February of 2020, a public relations and branding firm conducted a survey of 737 American beer drinkers and found that 38% of those would not buy Corona beer under any circumstance, and 14% of those surveys wouldn't even drink the beer in public. The corona in coronavirus means crown in Latin. This refers to the spike proteins on the outer membrane of the virus itself, not the crown on the picture of our favorite summer refreshment. These spike proteins actually help the virus dock onto the cells in our body and take over the cell's machinery. I guess you could say that the virus is trying to be the king of the cell. Oh, I can't believe I just said that. Fact number 3. Because of China's hardcore lockdown in an attempt to contain the virus, the country's carbon emissions went down 25% in 3 weeks. This, of course, is most likely due to the lack of airline traffic and the lockdown that stops industry, but 25% in 3 weeks is huge. China's total carbon emissions account for almost a third of the world's carbon emissions, and that 25% reduction leads to almost 7.5% reduction in the total global carbon emissions. Given that the rest of the world is now shutting down as well, I'm sure there's going to be a further drop in global carbon emissions, considering airline traffic and non-essential industries all being shut down. Before I continue to fact number 4, I just want to make a shout out and recognize all those on the front lines who are doing what they can to fight in this pandemic. This includes the hospital staff such as doctors and nurses, custodians, security. It includes people restocking the shelves like grocery stores, the pharmacists, the cashiers, the bus drivers and the pilots, and the flight attendants who are helping people get back home. Basically, anybody who's helping the sick and ensuring that the world continues to run during this pandemic. You are the real heroes of the story. So thank you. Let's continue to fact number 4. I hate to break it to you, but your mask is probably not doing anything to protect you from the virus. So I'd like to clear up the difference between the 2 main types of masks. The first kind of mask is a surgical mask. This is that rectangular piece of fabric that you see people wearing that covers the lower half of their face and goes around the ears. I want to be clear. This mask does nothing to protect you from virus particles that might be suspended in the air. It can stop you from touching your face, which is important, but it does nothing to stop aerosols from coming in between the mask and your face because it's not sealed. Of course, this mask is important in reducing you infecting everyone else because it will catch any water droplets when you sneeze or when you cough, but it won't protect you from actually getting the virus. The second type of mask is called an N95 respirator. These are those circular kind of masks that you see the doctors wearing that protect the nose and the mouth. These are so closely fitted to your face that they'll create a seal that protects you from your external environment and will filter in any air coming in. However, there are 2 main drawbacks. First, in order for the mask to be effective in protecting you, it must be fitted to your face so that it can create a closed barrier between you and your environment. Therefore, you can't just use any N95 respirator. You need to find the right size to fit you. Second, for all you bearded folk out there, your beard hairs are stopping the mask from creating a seal, and therefore it's not doing anything more than a surgical mask. There's currently a major shortage in personal protective equipment on the front lines, especially in masks such as the N95 respirator. So please, if you have some, consider donating them to the hospital, because you don't need them as much as the hospital staff do. If you are going to use a mask, use a surgical mask. That way you'll protect those around you and you'll stop yourself from touching your face. But leave the N95 respirators for the hospitals and those on the front lines. Fact number 5. The SARS-CoV-2 virus can survive up to 3 hours aerosolized or in the air, or up to 48 hours on stainless steel. A study in the New England Journal of Medicine on March 17th looked at the survivability of the SARS-CoV-2 virus on different surfaces outside of the body. The researchers found that the virus could survive up to 3 hours in the air, 72 hours on plastic, 48 hours on stainless steel, 24 hours on cardboard, and 8 hours on copper surfaces. This is why it's so important to wash your hands to stay healthy, as well as wiping down all the frequently used surfaces in your place, like your countertops, your faucets, your phone, your computer, etc. Bonus fact. Unless you're creating yourself a major social isolation fort, please stop hoarding toilet paper because it will not protect you from the virus. Hoarding products like toilet paper will stop those who really need it from being able to buy it. And trust me, I need it. There you have it, 5 facts about coronavirus and the COVID-19 pandemic. Which facts surprised you the most? Comment down below and let me know. If you enjoyed this video, please give it a thumbs up and consider subscribing because I'm going to be coming out with a lot of content during my social isolation. Stay positive and have a great day.